I'm Arnold Levinson. I'm an associate professor in the Colorado School of Public Health and the member of the University of Colorado Cancer Center. Smokers who want to quit have a choice available of a lot of different strategies, but the first thing to know is that most smokers choose to try to quit on their own without any professional help and without any treatment. That's the most common quit method. It has been that way forever. Starting in about 1996, nicotine patches and other forms of nicotine products became available over the counter. And ever since 1996, so about 20 years, an increasing number of smokers who want to quit have been using that product or some of the newer ones that have come into being. In carefully controlled studies, the use of the nicotine patch in a quit attempt increases the chance of quitting by about double. In more recent years, medicine has found that an old antidepressant called bupropion, repackaged and marketed as the drug Zyban, is very effective for quitting smoking as well. And so many people use bupropion. And then more recently, a newer medication, brand name Chantix, generic name varenicline, has come on the market, and it actually has slightly better results than either nicotine patches or bupropion. So really, with any one of these medicines, the odds of being a successful quitter double to triple. In addition to the medicines, counseling or coaching is very widely available, commonly used by smokers to quit, and it increases the chance of success by about 50%. Whether you do counseling or coaching in person with a doctor or a specialist, whether you do it in a class, or whether you do it over the telephone using one of the quit lines that's available all around the United States. The combination of counseling and one of these medications is even more effective than either one of them separately. Having said all that, it's useful to know that even with use of the medications, use of counseling, in other words, the best evidence-based treatments that we have, the best we've been able to see in population studies of people who are quitting is about 10 to 15% are successful at the end of a year. So one of the things to recognize is that when people try to quit, the first time may not be the last time they try to quit. When we do studies of people who have successfully quit and we ask how many times did you try before you succeeded, the average runs anywhere from 7 to 14 times. However, that average is really very bimodal, meaning that there are tons of people who quit the first or second time, and there's an equally large number of people who quit far more than 7 or 14 times before they finally got there.